Hello, guys. Welcome to our channel. My name is Jeff.
My name is Juna.
We are registered nurses, and this channel is going to be all about nursing and every aspect of it. That's why it's called Nurse Thoughts. So, I guess to start off, we'll introduce ourselves and a little bit of our background. Nothing too extensive. Um, so I graduated from nursing school in 2022, and I went straight into the ICU. I was fortunate enough to find a position, and I was in the ICU in the past 2.5 years. And Juna and I, we both have we went into travel nursing. So this month is our first contract together. Would you like to talk about yourself now?
Yes, so my nursing background is that I graduated in the Philippines and back in 2019.
You have to be closer.
I moved here during COVID times and took my NCLEX during COVID times too, and I started working back in 2022. I've been a med-surg tele nurse for 2 years and 8 months. And so Jeff and I decided to move forward and be travel nurses so we can save up for our future. And so, yeah, we are actually currently in Arizona.
Yeah, so that's where we are. Obviously, we don't have the greatest experience of being a nurse, but 2.5 to 3 years in, I'd say we've learned a lot, and we would like to share our perspective, our stories, and our opinions about nursing. And you can take it as an advice, you can take it as something to relate to, but nonetheless, in this channel, it's all opinionated. It's based on our experiences and our perspectives, and we have no intention to be more superior than other nurses. We have no intention to sound like we're the smartest people in the world, but I believe that we have the right to express how we feel about nursing, and hopefully you guys allow us to, and feel free to interact with us as well and share your stories.
So yes, disclaimer on we're gonna try to avoid being superior because we're not that type of person. We don't feel like there's a hierarchy in healthcare because we are used to working. We're used to working with other healthcare providers, healthcare teams. We collaborate with them, so for us, there's no one higher than the other.
Yeah, so let's get right into it. This episode we won't talk a lot about the topic, but since we had an introduction included, but I guess our first topic will be what really is nursing, and what is really nursing compared to how non-healthcare individuals think it is. So, would you like to begin, or me?
Sure, I can do it. So, I feel like a lot of people have the idea of what nursing is, and it's like a general thought of everybody that nurses help out the doctors, they're helpers, they carry out orders, they follow what the doctor tells them to, they clean their patients, and they give medications. I feel like that's the most general that I can come up with. And I feel like it's a 50-50 that yes, it is true that we help out doctors, but also the doctors helps us. And it's not just the doctors. There's a lot of people working to help the patient get discharged, to help the patient get back there on their feet, to help the patient go back to their normal lives. And it's not just us being a helpers to the doctors, but The doctors also help us, the therapists, case managers, and all other stuff. Even EVS, cafeteria, they really help out a lot in recovering the patients. And so, yes, the nurses, we give the medications, but it's not always that what the doctor orders, we just give it right away. We also have nursing judgment that we call, and we look back and see if it is actually safe and if it's appropriate for the patient to get or to take. Because sometimes what we see in the computer is actually different in what we see in the patient. They can be really good, their labs, their vitals, but clinically, the patient can look really bad. And sometimes other medications are not appropriate at certain times. So we also use our nursing judgment, and we don't rely on the doctors, on the case managers, what they suggest, but we also listen to the patient. We try to empathize and to the patient and to their families. And yes, we do very much emphasize on cleaning the patient because, I mean, that's one way of preventing infection, I mean, generally. So that's why I guess you can say some of the nurses are kind of OC, that they want everything clean, and they're hypochondriac, that they overthink of little things. So I think that's what non-healthcare individuals think.
Yeah, and then also, like, that quote, or usually that's always been said around the hospital or even in social media, that phrase, "you're just a nurse," or "we're just a nurse," is, there's a lot of meaning that could go behind it, but usually the intention for that phrase is, you're just a nurse, you're nothing more to it. All you really do is just clean the patient. You're not someone who can really, heal my family member. You're not someone that can really cure somebody. And a lot of nurses, I'm pretty sure every single nurse wants to debunk that kind of theory behind that quote. So I'm sure everyone can relate. It's more to it than just being a nurse, because being a nurse also includes having the compassion of the job that we do, the emotional state that we have to go through, the mental state that we have to go through in a 12-hour shift, the physical aspect of it in a 12-hour shift.
13 hours.
13 hours, 14 hours, 15 hours in one shift, having to come back the next morning, night. So if there's something that I would really clarify with individuals who can't really explain what nursing really is, and coming from our perspective, I would say that we are also humans, and we are also people, and we have a job to do, and everything that Juna said of what comes being a nurse in a clinical setting, it's more to it than just cleaning butts. It's more to it than just listening to your concerns. It's more to it than just being bedside, checking your vitals. No, there's every aspect of judgment that has to come with it. And I think if I would really like to relay that message especially to family members, that we go through a lot as well. For family members, for anybody who's not in the hospital setting all the time, it's not their job. You guys are there for one day, and we can't blame you for not knowing everything about health related issues. You're not meant to be in the hospital. Nobody wants to be in the hospital. But us nurses, we're there 3 to 4 times a day, even 5, not a day, a week, 3 to 4 or 5 days a week. And we know how things run in the hospital. And it's not to say that we are tired of doing our job, because not every day is the same, but there are days when it's just too much. And unfortunately, you family members can tend to be in the day that we work in, that we're not having such a good day, and they don't see what we go through. They only see us what we do in their rooms, in their patient's room, and they don't know what it's like going in other rooms because you know, your mom, your dad is dirty on the bed, but I also have someone else on the next room who's literally about to die, who's literally on low blood pressure. And unfortunately, we don't have all the staff in the hospital, which is, by the way, one more topic that we'll go through in the future about being understaffed. Like almost more than half of the hospitals in the state, not even the state, the whole nation is understaffed. And it's unfortunate that we can't be on top of the needs at the right time and a certain time. So nursing, what really is nursing? I can reiterate it again. We do a lot for the patients, and we do try our best. We do what we can because we signed up for the job, and we don't want to lose it, and we don't want to leave a bad impression to family members. So I say that's one thing. We're not just a nurse. We're still humans on top of it. So
Can I also add something? Yes, we really do try so much for our patients, and that's only we can't say for every nurse, because a lot of nurses are also burnt out. I feel like we do a lot because we're new nurses. We try to be very in the moment for the patients and their family, and sometimes it just takes also a toll on us. When, say, I'm a nurse in med-surg tele, I had 7 patients, and one patient can be crashing, but the other patient can be just demanding in the sense that they want water right now, they want to go to the restroom right now, and those are basic needs that we need and we understand. But that's when the nursing judgment comes in, and we have to prioritize, unfortunately, not those basic needs. We prioritize the patient's life, the ones that's crashing, the one that we can barely get a blood pressure on, and the one that's actually gasping for air. So, and I get that family members have a lot of experience from other nurses that, oh, they just see, nurses in the station, they forgot this, they didn't do this. And I can't speak for those. We can't make an excuse for that. We don't know what happened there, but I guess we're just speaking for ourselves that we do try so much to cater everybody's needs, not even the patients, family members, doctors, our managers, our directors, our charge nurses. We try to, I guess we're like a people pleaser, in a simple term. But yeah, I guess that's what we want to emphasize on this first question.
Yeah, and that's pretty much gonna wrap up this first video, or this first episode. In the future videos, we'll obviously have more time to talk about these certain topics, and hopefully you guys keep following us and support our channel. And we'll leave our social media, we'll leave email addresses. Leave us a question, give us anything, give us ideas what to talk about our next video. So thank you for listening if you stayed throughout, and we'll see you next time. Okay. Not bad.
Not bad. I was wondering,